Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am super excited to have Amiee and Brent House on our podcast today, on our midweek podcast, streaming today on Wednesday, because Janet and I will be traveling tomorrow for an educational seminar on hormones. Stay tuned for that. I'm super excited to have them on. They are owners, husband and wife owners of a laboratory in Tri-Cities, Washington, in Kennewick, I believe, and maybe Richland. They'll clarify that for me. And they have just recently went to cash only. As you guys know, we talk a lot on this podcast about free market healthcare and how that is the future of healthcare. And it's a way to seek affordable services, whether it be pharmacy, whether it be doctor's offices, whether it be laboratory services, paying cash, bypassing the insurance system. Yes, you will get better price, you will get better service, and you'll get better quality. And Amiee and Brett are going to talk to us about that today. So Amiee and Brett, welcome to our show.
Thanks for having us. We're excited to be here.
Yes, thank you. It's great to be on your show.
I love it. When I first was referred to you guys, I was super excited to hear about you guys, a husband and wife team running a laboratory. Of course, my wife and I are a husband and wife team running a pharmacy. And when we went cash only, 20 years ago now, we were called crazy. We were called, we were told we wouldn't be in business in a few years. And our colleagues told us we were crazy. We needed to take insurance to get all the volume. Our employees told us we were crazy and we wouldn't be in business. And our family and friends told us that. And 20 years later, we kind of are pioneers in the free market healthcare arena where people are, where healthcare providers are getting out of the insurance system and charging cash prices. So tell us a little bit of history of your lab and how that happened.
Okay. Well, we started our lab 2 years ago, and we started our lab doing COVID testing. Now I'll start by saying we do bill through insurance for COVID testing. That was because of the CARES Act. And we, of course, to get started, that was how we had to do it. But then and we've been doing COVID testing for the last 2 years. But then about a year ago, we decided we want to get into other lab testing, especially the direct to consumer type, where we would offer lab testing to customers where they can come in and order their own test. That's a fairly new thing. It's happened just in the last several years in most states in the United States where a patient can order their own lab test.
I think it's 39 states right now that it's legal to do that. Not every state.
And that includes the state of Washington. So we decided we wanted to offer not just COVID testing, but any kind of lab testing that you would normally get if you went to the doctor's office and they wanted to order some lab tests. So we've brought in a lot of different testing. Well, we started doing that a year ago, and initially we were billing through insurance for all of that testing. Well, we found out that there were a lot of problems with billing through insurance. The first one is it is incredibly complex. It's difficult.
It's not transparent.
It's not transparent, to us or to the patient. And then we found over the months that we did that we weren't getting payments from the insurance companies in a timely way. You could send the same claim to a single insurance company and you'll get a different answer from them every time. They'll cover this one time, then they'll cover something else the other time. It just seems kind of arbitrary how that works. And then a lot of times, much of the responsibilities goes back to the patient. And because it costs us so much to bill through insurance, we have to charge more money to go through insurance. Mm-hmm. So then the responsibility comes back to the patient. They end up paying more money in the end. And this is months after they got their lab test done. So back in April of this year, we just decided we are going to go strictly to cash pay up front and lower and then really give as literally as low a price as we can. So when I did the financial numbers, I said, if we're just having them pay up front and we're not having to go through, the administrative costs have gone through insurance, how much can we, provide this testing for? And so we created a really low price and said, here, pay for this up front. And like you said, when you make that decision, you worry. And people call you crazy and they say, you're not going to get enough people to do it. And we've had a number of people come into our lab already and say, well, I want to go through insurance, so I'm not going to come to you guys. And we'll explain to them, well, it's in the end, it's going to cost you less money. And we've had several people say, well, I don't care if it costs me more money. I still want to go through insurance. I think it's one of those things where it's hard to change from one thing to another. So we knew, like you said, that making that decision meant that some people were not going to come to us, that we were going to lose some business there. But we also felt very strongly that it was the right thing to do, that it was something that would save customers money, and that we feel like we're being more honest. If we have a customer come in and we're going to bill through insurance, we have to bill more money because we know we're going to pay all this money to a third-party billing company, and then the insurance gets their cut. And I just feel like that's not being honest to the customer. We can say, if they come in and pay cash, we can say, this is how much it costs us. That's it. You pay this amount of money, and that's honestly what it is. That's all it is. So,
well, like you said earlier, you mentioned the word transparent, and that's something that I think in free market medical services is really coming up over and over. Transparent pricing. I mean, go into most any place that bills insurance for healthcare now, whether it be a doctor's office, whether it be a hospital. Don't get me started on hospitals. Try to get a price out of a hospital is like pulling teeth. Laboratory services or pharmacy, and call them and say, well, what's the price for XYZ? Well, we don't know. We'll bill your insurance. I didn't ask that. I asked what the price of service was. Well, really don't know. Your insurance tells us. Well, give me a cash price. Well, we don't have it. Well, I mean, how can that be? I mean, imagine going to a hotel and saying, I want to check into the hotel tonight. What's the price? Well, we really don't know. It's complicated. It depends on this and that. Well, no, it doesn't. Just tell me what the price is. So it's about transparency. And that transparency, if you don't have it, leads to surprises. How many times has a patient billed their insurance for lab services? You told them, well, it's going to be $100 if you pay cash. Through your insurance, we have to bill them a different amount, and it may or may not be covered, and they end up paying $800 out of pocket, and they're mad. All the time. That happens.
Well, we can give you a couple of examples.
Please, I'd love it.
Yeah, we've had a number of customers come in. One of them came in, all they were going to order was a vitamin D test. And they went to another laboratory in town, and the other laboratory quoted them $300 to get this vitamin D test done, because it was going to go through insurance and all this and that, and that was how much they were going to have. And actually, the $300 was going to have, in this case, they were going to charge them $300 up front, and then say, we'll figure it out through insurance afterwards, and you might have to pay more after that, which just seems mind-boggling to me. So they came to us, and I can't even think off the top of my head how much it costs for us. I think it's $50-something to do a vitamin D test. That's 1/6 the cost.
Right.
And they were like, this is amazing. I'm going to come and use you guys. We had another customer come in who has a health condition where they need a certain number of tests every month. Well, the insurance is only going to cover it for like 1 or 2 months out of the year. So, which again is it's a thing where someone at the insurance company is arbitrarily saying, we're only going to cover this 1 or 2 times out of the year when their health says they need it every month.
Right.
which doesn't, again, that's allowing insurance to take control over what you can do with your health. So they even billing through their insurance for those couple months a year, and then they have to do it every month. They were saying that these tests were costing them over $200 a month to do these tests. When they came in and priced it out with us, it was less than $100 a month.
It was like 89.
It was like $90
So
or
half,
something.
more than
So they
half.
were going to save over $100 every month by paying up front. And so those are just a couple of examples we've had of people who are saving money by just paying up front.
Well, and I want to discuss the new law that came into effect in January that affects transparency in billing. And I think there's been a lot of misinterpretation of what it means. So that's a whole nother subject because people are applying it a little bit differently than others. But I have noticed that there has been more prices posted, like a nationwide lab. When you go to their website now, as in the last month, they have posted prices for their tests, which was required by that law. The problem is it's still a super inflated price because it's either the cost before insurance or it's the cost after, but it's so inflated. And I think they can post either, because then they have to then a customer would need to go to insurance company and say, well, how much will you cover? So I don't know if the law requires the lab to factor that in or not, but regardless, the cost is high. And I mean, we aren't trying to seem like we're not getting paid. We have employees, we have equipment, and we have to get paid. But the problem really is that lab tests never should have cost that much. Yeah. They don't cost that much.
No.
But they've been inflated for so long that we've all become used to a thyroid test costing $150 when it doesn't. To run a thyroid test is like $30 or something. Yeah. I mean, so if you have to pay your people, then you end up charging around 50 or 45, but 150 is ridiculous.
Yeah.
And I think the issue just really is what we've learned to accept, and now that we need to educate. We need to get education to say, wait a minute, this isn't how it needs to be and how it should be. There's so many benefits from really getting transparent. A lot of hassle goes away. I don't have to have a billing person anymore. Right. I don't have to pay another employee.
Well, and I think a good example is you look at this last year with inflation. So we've had inflation over the past year, so it's been high. But then you look at the numbers and you see that the CEOs of all these companies are making more money now than they did before the inflation happened, which is the opposite of what you would like to see. You would like to see CEOs making less money so that they can help save the consumer money. But what happens is, whenever you have an expectation, a financial expectation, people take advantage of that. Right. You know, there's an inflationary expectation. Oh, we've got high inflation, so people expect to pay more money for their groceries or for their gas or for their housing. Well, what happens is people say, well, I'm going to take advantage of that expectation. So I'm going to charge, even though you know, my increase in costs would tell me I need to increase my prices by 10%, say. A lot of them say, well, I'm going to take advantage of this because everyone's expecting this super high inflation. I'm going to charge 15% more, and I'm going to pocket that extra 5%. Well, I think the same has happened in insurance, is that over the years, people have just come to expect high costs. This increasing high costs.
Yeah, good point.
And I would say it's across the board. Insurance companies, providers, anybody involved in healthcare, they take advantage of that. They say, you know, there's a new law for transparency, but before that law came into place, there was no transparency, even no expectation of it. And so I think a lot of people said, well, how can people are going to get a bill 3 months after they got the service. And once you get that bill, people just feel like, oh, well, I already had the service. I'm obligated to pay this whole amount. And so just fees get added on until it's this giant amount. And unfortunately, that's how it's become. I feel like what we really like is we're saying, you're here to get a service from us. This is the exact price for that service. And you're going to pay it right now so that you don't get a bill later on. There's no deception here. There's no, we're not going to pile on something later.
Right.
And so we're trying to just be honest with our customers and to give them a good service, to provide a good customer experience, for them to feel like that there was a service given, a fee paid for it, and that's it. There's nothing else involved with it.
Yeah, it's transactional between a consumer and a vendor. And that's like every other industry. And if healthcare was like every other industry, it would be a lot less expensive, just like what you guys are doing. But you throw a third party involved when somebody else is dictating the price and the service and the quality, literally, then all bets go out the window. And the way for the consumer to benefit the most is the consumer pays directly for all kinds of services, because that's going to make you and I, as vendors of those services, do the best to that customer that's standing in front of us. Yeah. And in healthcare, if you notice, when you go to a typical hospital, let's just face it, the service sucks. I'm just going to say it. Because they don't care about the consumer sitting in front of them, because the consumer is not paying the bill. Yep. But all of a sudden, if Medicare and Medicaid writes them a letter and says, we're going to hold your checks until XYZ happens, boom, they jump.
Yeah.
And that's just not how it should be. I mean, the consumer should be the one that is paying the bill and gets the service, and then they'll get the best quality, the best price, and the best service that way. So that's one of the reasons, and you talked about it. It's about education. That's why I had you guys on this podcast, is so we can educate and empower consumers that insurance is not usually the best option for your routine type services.
Yeah.
Right.
Sure. You get big cancer, you get a heart attack, you're going to need some kind of insurance. I get that. But for your routine, basic doctor visits, basic pharmacy visits, basic lab visits, it is best to pay up front.
Well, and we're grateful. I mean, we're so grateful. It's easy to get really negative about this subject because it's been so hard for so long. But we are very grateful for what has the good people that are out there trying. There are good insurance companies who are providing catastrophic care that you do need, like you were just saying. But there is a better way. We've settled for some things for way too long, and it has become subconscious now, and we need to bring it back up to the front and start re-examining it and offering better ways. And I think holding people accountable for a service. You should be held accountable for what you offer. And it is fair to do it that way. And the way that it has been for a long time has actually been very unfair to the consumer. 100%. I agree with that.
Yeah.
I think we're kind of at a tipping point now. I think COVID exposed a lot of things.
Yes.
It exposed some of the downfalls of the system. And now when you talk to a lot of patients now, for instance, I was talking to a gal in Spokane yesterday who's a nurse practitioner. She is a cash-only nurse practitioner, and she has more than a handful of Medicaid patients. So here these patients are paying her cash. These patients are state pay. They pay zero for healthcare. But guess what? They can't get in to see their doctor for 8 months.
Yeah.
Right.
So they are paying out of pocket for services because, and remember what you were talking about, things being free? When something's free, I think we were talking about that before the show. But just because something's free doesn't mean it's available.
Right. That's true.
Right.
That's what we're seeing with healthcare.
Well, and I would say in Tri-Cities, I've heard different people identify the area as a medical desert almost, because so much growth happened so quickly that
And
not enough healthcare providers moved in to handle the amount of people that require care. So what we're seeing here is a bunch of urgent cares have gone up, private urgent cares, which has been a way for people to access healthcare. And I'm also starting to see a lot of doctors who worked for groups are breaking off and opening their own private clinic that is mostly cash pay focused.
Yeah.
Because it's so much easier. They're tired of jumping through all the hoops and red tape, and they're providing way better service. You get, instead of 6 minutes with a provider so that they can meet their price point goal, you're getting an actual half an hour visit or a 45-minute visit or whatever you need.
Well, yeah. And so I wanted to bring up a point when you talk about insurance versus cash pay, that comes to the point of quality of care.
Absolutely. Yeah.
So what's happening is these insurance providers, including Medicare and Medicaid, are determining what your health care should be. Because Medicare is saying, well, we will cover this test once a year or twice a year. And it's a one size fits all type of decision. Well, that's not what helps the individual have the best health care they can get.
Yeah.
And so we've had several Medicare people who have Medicare come and use us because Medicare will only cover, that test twice a year. Well, they want to get, like, we had a discussion with one gentleman who had prostate cancer, had his prostate removed. And of course, you want to look for PSA, which is a marker for prostate, to see if that cancer has come back. Well, Medicare is only, says they're only going to pay for that test once a year. Well, this person wants to do it every quarter for peace of mind, to see, and that's the healthcare they want. So if you go through insurance and you're depending on what the insurance will cover, you're not going to get the health care that you want, or even that you and your doctor decide is best for you.
Yeah.
And so when you go with the cash pay model, it doesn't matter because you can come in and pay for that service whenever you want. So I think that's another thing where we feel like we can provide. The other thing too, related to that, is that a lot of these big labs, they don't let you come in and order your own test. They don't let you come in and pay up front because they know that they can get more money if they bill through your insurance. And so
or they've made contracts.
Yeah, they have contracts.
Yeah.
So they have these policies. And so we've had some people come in too who came to us just because we're the only lab that would accept them, like the other labs won't accept someone who
and then they loved us,
insurance,
so they stayed.
Yeah. So
well, I guess I wanted to add on that and just say, this idea that you get to control and make your healthcare more personal. Yes, we need the skill that a doctor has to consult with them, but ultimately it's your body. You have to decide what you want. If you have a thyroid disorder, don't you think that getting a thyroid test once a quarter would be more beneficial so you could see over time what your thyroid is doing?
Even once a month,
and then all of a sudden it becomes the same price. I could do 4 thyroid tests in a year and see a picture of how my health is doing in my thyroid for the same price as one thyroid test that was billed through insurance that didn't get covered and I paid $100 and whatever for. I can do, if I have diabetes or pre-diabetes, hemoglobin A1C needs to be tested. My glucose needs to be tested. And I can either go to a doctor and say, I can pay $200 for an appointment to get my lab test ordered. Go get the lab test, come back and have the doctor read it with me. Or in a direct consumer state where I can order my own tests, I can come in and get my hemoglobin A1C tested 3 times before my annual physical. Take it with me and show the doctor a picture of my health over the year, where then the doctor can make much more informed decisions because they're seeing who I really am through my blood.
And you
Well,
order it, and that test only costs $30 or $40, you know.
right.
So,
And really what that's doing is it's putting the consumer in charge of their health care. And that's what really needs to happen.
yeah.
And I think any doctor, I would hope, any doctor that's taking care of a patient should be okay with that. Because let's face it, I mean, doctor literally, you know, if you look at the Greek meaning, means teacher. And ultimately, at best, a patient sees a doctor 1 hour every 4 or 5 months. Okay. That's generous, actually, probably.
Oh yeah.
Yeah.
I mean, really, honestly. So
Usually you only see your doctor for 15 minutes or 10 minutes.
and that's once a quarter or something, right? I mean, so let's just say an hour a year, but you've got 24 hours a day to take care of your body.
Yes.
Right.
So one of the reasons that we did this podcast is to educate and empower consumers to take charge of their own health. No matter what disease you have to take charge of your own health. Yes, you have to seek lab services, pharmacy services, and doctor services to help you do that. But ultimately, the consumer's got to be in charge. And that also means, in my opinion, ultimately, financially, they should be in charge.
Right.
Right.
You know, because that's going to give you the best quality and service.
Yeah.
Yep. Yeah. Well, and I talked earlier about the quality of healthcare in general, but I think one other thing I wanted to bring up is just the quality of the lab testing itself.
Yeah.
So some people have asked us, "Oh, you guys, I can just come and order my own test." Well, is it a different kind of test than if I got it through my doctor? No. Like, we're a clinical lab. We are accredited through the state of Washington. We run exactly the same tests that we would run if a doctor ordered it, as if it's run on the same instrument. We're using the same supplies and reagents. The same people do it and result it. And actually, I would say it's even higher quality, because if we don't have to have the administrative burden of going through insurance, we can focus the money that we get from our customers towards better quality. And even though the test is run on the same instrument by the same people, some of the errors that happen in a lab are specimen mix-ups, the wrong result put into the wrong person's, file, things like that. And when we can take our administrative people and have them focus on that kind of thing instead of insurance billing, we can make fewer mistakes, fewer administrative mistakes on the lab test resulting side. So I feel like when we do a cash pay model, we're actually providing a higher quality of lab testing to our customer.
So I'll agree with you. Yeah, I'll agree with you on those points, because all you're focusing on, focusing on just the lab testing. You're not dealing with any kind of billing whatsoever. I had a doctor point out to me, now hospitals do not like to admit this, but we use this example often because the Surgery Center of Oklahoma, cash only surgery center, opened down in Oklahoma City in 1997, way ahead of the game. It took them a few years to fight some insurance companies and some state regulations and stuff to open up, actually, but that's kind of their opening date in 97. But they didn't really start practicing until a few years later. But anyway, so I've met Dr. Keith Smith. He's an anesthesiologist, co-founder of the Surgery Center. And I've toured the facility. He's a pioneer in free market medicine.
Sure.
And he was giving me an example of why their quality is better than a hospital. Because hospitals, well, if it's less expensive, if it's 8 times less expensive than the hospital, then they must be cheaper services and they're not as good a quality. Hospitals always want to say stuff like that, right?
Sure.
And this is what Dr. Smith said. So Dr. Smith says our quality is better because we have less expensive prices. We don't have a margin of error to mess up. So the same surgery that's $50,000 at the surgery center or at the hospital, is like, $8,000 at Surgery Center of Oklahoma. So here's a good example. And I know I have a dear friend who manages a surgery center which is owned by a hospital. There will be doctors that will open up a sterile package of something that's like $2,000, and they just did it by accident. But they don't really care because they've got a huge margin there, right?
Yep.
Well, I guarantee you that if that surgeon did that at the Surgery Center of Oklahoma, they would never be invited back.
Mm-hmm.
You know, I mean, that's part of the quality that happens because you can't make mistakes because you don't have the margin. So, you know, you're focusing on the patient only and, you know, good quality, good service. And when there is a problem, Dr. Smith told me there's been a problem, like a knee went bad, you know, a total knee went bad, and it was a non-compliant patient.
Mm-hmm.
They did the surgery again, didn't charge them. That would never happen in a hospital, ever. I mean, hospitals are notorious. They'll actually do the wrong surgery on the wrong knee. They'll come back and charge them for the next knee. Unreal. I mean, and we accept that. We accept that because somebody else was paying the bill. If we were paying the bill, the individual consumer is paying the bill, we would never accept stuff like that. We would say, no. I mean, think about that. If you took your car to a mechanic and they fixed it, but they didn't fix it, and it was broke a week later, the same thing, you wouldn't go back and pay again. You'd say, no way, fix it.
And I want to bring up actually that actually what you said was not true. We are paying for it. We're just fooled. We're just
exactly
fooled.
Right. Thank you for clarifying that.
We're fooled into thinking that we're not paying for it, but we are. So the insurance company is covering it, but they still make their money. And how do they do that? They increase premiums.
Yep.
And so we're paying for it. So we think, oh, it's okay because that they wasted thousands of dollars while I was in the hospital because my insurance is covering it. Well, who's paying for that? I am. And everyone else who pays into that insurance. Yeah. So you're right. I think that insurance has enabled behavior that is lacking in quality, in accuracy, in cost, allowing for cost savings. And so you have a lot of waste and lower quality healthcare. That's what it's led to. Absolutely. So I agree. If we can get to a point where people pay for their healthcare and they can shop around.
There you get your supply
demand. Then you have that economic drive again in a free market competitive marketplace that where you realize that I've got to provide good quality, I've got to provide good customer service, I have to have reasonable prices, I have to have all these things that eventually will lead to better quality healthcare. And unfortunately, our healthcare just has gone down this road of where it's, like he said, we think we're not paying for it, but really we are paying for it.
So tell me a little bit more about your guys' lab services. So you started out doing COVID only. So now you guys have expanded those services. Are you, and I don't even know what the right term is, are you a full service lab now, or what kind of tests are you offering now?
Yes, so we are essentially a full services laboratory. We do a lot of tests in-house, a lot of the basic tests, the CBC, the CMP, thyroid tests, diabetes, anemia, things like that. We can do most of those things in-house. We do have a reference laboratory, so if it's a test we don't run in-house, we can send it out and have it tested.
And we still do the cash pay up front, and exactly how much it is.
Yeah, we do that even for the tests we send out, because we have a price that we can get that done at a reference lab. We charge and actually for send out tests, we don't even add a fee on top of it. We just charge them exactly what the reference lab charges us. So we feel like that's more than fair. We do charge, to draw blood and then to do the testing in house, but we're trying to provide as low cost of service as we can, because we just feel like people deserve that. Now, as you can, we haven't really talked about the name of our company, and maybe I could talk a little bit about that, because that tells you a little bit about what we do and what we plan on doing. Tomorrow's Health, we came up with that name because we want to get into preventive health. So this idea that, and this goes to encouraging customers, patients, to be more in charge of their own health.
Yeah.
And a lot of that is prevention. What can I do in my life to prevent bad health consequences in the future? So that's why we called ourselves Tomorrow's Health. What can we do today,
right,
to make tomorrow's health better? And so, you know, the direct to consumer, the ability to monitor things like hemoglobin A1C or our sugar levels in our blood, or monitor a PSA to look at our prostate, to be able to monitor things to prevent disease or to mitigate the effects of
that's our
disease.
goal.
That's our goal, is preventive health. And we are going to, in the future, get into, hopefully, genomics, human genetics.
Yep, that's coming.
Looking at people's medical history, and providing people with plans, and as part of that plan is you do lab testing, you do screening. And if you think about how much money you save, even just money, but obviously more important is quality of life, but even money, if you can catch cancer, for example, any kind of cancer early,
saves a lot of
you're
money.
going to be able to treat it, you're going to have better quality of life, and it saves a lot of money. Doing lab tests to screen for different cancers is so much cheaper than treating cancer if it's third and fourth stage. And then, of course, you can die from it. You can have a really low quality of life with that. So,
and it's amazing that blood does not lie. I mean, sometimes blood is moment, but it's honest. Like, I didn't really understand that before we started doing this. And I was like, oh, your blood tests are very, very good at looking at where you are in that moment and helping you track over time what you're doing and if it's working for your body.
For sure.
And it's amazing. We have a lot of clients now that are coming in from gyms, like fitness centers, because they're trying to figure out what is their hormones doing.
Absolutely.
And if you're using for example, to get hormones, you need to know what effect is it having on you. So it works in conjunction with a blood lab in order to figure out, is this working? Is my body responding? Am I going to get the benefit of optimal hormone balancing? Can I find that? Yes, you can.
And a lot of times in medicine, you know, people get treatment. It's a lot of it's empirical, right. Where, you know, a doctor might say, well, let's treat you with this, and this might help. And a lot of times they'll say, we'll have you do some tests in 3 months.
Right.
Why 3 months? You know, why not do a test in 2 weeks and then one in a month? You're just going to, because in some cases it's useful to do that. Well, you can only do that if it's affordable.
Exactly. I was just going to say, it's affordability.
Yeah.
And that's, I think, that's why we've got, and doctors, I think most doctors know that if I could do lab tests a little more often, I could get a better picture of my patient.
Yeah.
But then they realize that it costs so much to do lab testings, billing through insurance, that they're like, well, I'm not going to make you do that, even though it's better.
Right.
And so it's not affordable, but it's better. And so, and there's been all of these cost analyses looking at lab testing, and saying, well, we shouldn't do this testing this often because it costs too much money. Well, and so then you say, well, but is it better? Well, it is better for certain things to test more often, but it's too expensive. Well, then let's figure that out.
Right.
Well, one of the solutions is, let's do a cash pay model where it's cheap and you don't bill through insurance. and the patient can order it themselves. It doesn't have to come through the doctor even. And then they can get a lot of different data points that helps the doctor understand what their health really is.
Absolutely. We had a comment early on in the show. I wanted to show this to you. Mark Keith, he's a office manager for a nurse practitioner down in Umatilla, Oregon.
Oh,
and it'd be somebody good for you guys to connect with.
All right.
Yeah, we'll have
you.
to do that.
Say hi to Mark.
Hi,
Yes,
Mark.
hi, Mark.
Thanks.
Jennifer Keith Armstrong. So, yeah. So as we wind this podcast up, I want to thank you guys so much for being on and leading the way. I mean, this is super cool. I'm excited for where your guys' lab is going. I'm excited just for free market medicine principles in general, because I do believe it's a future of medicine. I don't believe we'll ever totally get away from government healthcare, but there's going to be at least options for consumers, and that's what I want for myself and for patients and consumers. Just that they have options, that they can shop for healthcare, and they don't have to be told where they have to go. So tell me what your guys' passion is. What is your guys' passion?
I mean, I think that our passion is helping people. We really both have that desire. Yeah. We came into this business. I'm a teacher. I have a master's in education, and I've taken a sabbatical from teaching to help do this. But I think both of us got into the fields we've gotten into to help people. We really want to. That's what we care about.
Yeah, I think I got a PhD in kind of soil microbiology, but at some point wanted to get into the medical field because of that. Just feeling like, hey, I'd like to, provide some service to the community as far as healthcare goes. And this pandemic has really shown how unhealthy we are as Americans overall. And if we can get into some preventative health and help people become more healthy, we're into that. And direct to consumer, cash pay, preventive health, those are all topics that we're into, and we believe it can improve people's quality of life.
Yeah,
and that's what we want.
Precision medicine that's focused on you.
Yeah.
And I guess that's our passion is also just that we have choice. Choice is our passion too, that we each have the right to choose. And we live in a country that has gone through many conflicts in order to provide freedoms. And I don't like to see that we've lost some of that in our healthcare. And I'm grateful. I am so grateful for what we have. We've lived in other places. We've lived in another country and seen the gifts and blessings that we've been given here in our country. So I don't want to seem ungrateful for anything, but I also think we still have to continue to fight and vote and speak out and educate for continued freedom. That is what we need. And
Amen.
That is helping people. That is helping ourselves and our loved ones.
So if people want to find out more information, is the website the best place to go?
Yeah. Yep. Tomorrowshealth.net is our website for our lab. And as we roll out the next parts of our business, hoping to be able to focus on preventative medicine, you'll find everything there. Right now, our lab is located just in the Tri-Cities, and we are grateful to serve this community because they really do need more options here, and we're so grateful for that.
Well, and I would say if you go to that website on the top right-hand corner, there's a contact us. That email comes directly to me and my wife, and we like to respond within a day or two. So literally any question that you have about what we're doing or how we can help you, send that to us and we'll respond.
Yeah. We wish every state would go to direct to consumer, and because we're getting messages from people in other states that don't have that saying, will you test me for this? Because my state won't let me order it and my doctor will not.
Yeah.
So I've got a few questions already.
Okay.
When a couple of doctors and providers found out that we were interviewing you guys, and they're from out of the Tri-City area, Are you guys
Yeah.
looking to expand anywhere in Washington?
Well, I mean, we've got to establish ourselves here first, but yes, we would love to expand.
Yeah.
But honestly, my model would be not that we would expand our company, but that maybe we would find someone in another community who is interested in starting up a lab, and we would just help them start it up.
Awesome.
Because I think that's what works best. I think you get someone in a local community who loves the community, who loves the people there, has the technical ability to do this kind of work, and you help them do it. That's what I would prefer, instead of because I don't want to become the big lab that is so bureaucratic that they can't move. And
I love it. That's our goal of our pharmacy. I mean, we do serve other states, but we have one location, and that's how we're keeping it.
Yeah. So we would open up a consulting service where we could go in and help other labs open up doing the same type of thing we're doing.
Yeah.
So if someone reaches out to us and says, hey, we'd like to start up a lab in our local community, we'd love to just help them. So, yeah.
Yeah.
So I appreciate you guys being on our podcast. You guys have definitely helped realize our goal to educate and empower consumers to take charge of their own health. And you guys want to stay tuned for next Monday's podcast, 12:30 to 1:30. We have Dr. Michael Turner, who is in Kennewick. You may have heard of him probably. And he is going to be talking about 5 lab tests your doctor has to order.
Oh, so good.
You want to tune into that one, and listeners and viewers, tune into that one, 12:30 to 1:30 Pacific Standard Time, right here on the Moses Lake Professional Pharmacy YouTube site and my personal Facebook page. So don't miss out on that. And as always, thank you, Amiee and Brent, for being on our podcast. Thank you, listeners and viewers, for tuning in today. Really appreciate it. All right, stay in touch.
Bye.
Bye-bye.